Nick Prather. I am with USI. I'm an employee benefits consultant. This was a really tough year when it comes to renewals. In my metro, the Kansas City area, we were seeing about an 18% trend. So it's this, constant tension of, can we continue to sustain this model, or are we going to have to endure turnover that we've never seen before within our organization? So I did find that a number of organizations this year were curious about alternative funding for the very first time, almost because their hand was forced. It was just a number that they'd been chasing for a long time, and this was the year that they felt like the dam was about to break. 95% of my book is currently on an alternative funding strategy. And of course, reference-based pricing is the largest portion of my alternative funding strategy that I deploy within my client book of business. I believe that it is the best way to remove the mystery from claims management as well as claims cost in general, cost containment. I think the biggest challenge with reference-based pricing is the change of consumer experience. I think they have been so used to and indoctrinated to have a card in their hand. When you take that logo off the card, there's just a lack of familiarity. And anytime that happens, you're going to have people that are scared of change. And so you really have to go out of your way to make sure that you educate not only the employees, but every stage of management within that employment and employer organization. So I make myself available as a consultant, but i360, Imagine 360 does an incredible job of providing all of the resources, whether it's through the direct account management partnership or the call center that they provide to make sure that they satisfy the questions that are coming from the field. It meant something to have a local in the Kansas City market that would be accountable and responsible for the services and outcomes that Imagine 360 was promising. And so in the end, that's what they provided, was somebody that could, literally shake their hand, be a face and a presence within their organization. But the employer themselves are running at 141% of Medicare, which is far better than what we had promised. And we continue to see tens of thousands of claims with this particular client, and yet we have not had a single balance bill land in the hands and responsibility of an employee. In this particular case, the savings was so significant that we were getting a huge impact towards the reserve. That led to a really easy discussion on how to reallocate this surplus. And we were able to cut into the premium, and the employer contribution towards the premium was increased. I feel like I've got my clients in a better scenario with reference-based pricing as opposed to something that is of lesser value, in that sense of exposing the employees to additional cost outside of their premium and their out-of-pocket maximums. So I feel very comfortable with where my employees are.